Good afternoon, Professor Shane Dark, and welcome to the first of our weekly NDARC webinars for 2022, broadcast as always live from the ballrooms of Mars. Now, while we are widely dispersed, we acknowledge traditional owners of country throughout Australia, recognise their continuing connection to land, waters and culture. We pay our respects to their elders past, present and emerging. Look, it's a really great pleasure to start our series today by presenting to you Dr. Colin Mendelsohn, who is a GP who now works exclusively in tobacco treatment, helping smokers to quit. He's also an associate professor here at the University of New South Wales. Amongst his many other hats, he's a member of the expert advisory group that develops the Royal Australian College of General Practitioners National Smoking Cessation Guidelines, founding chair of the Australian Tobacco Harm Reduction Association, and is currently an investigator on an NHMSC funded clinical trial on vaping that's being conducted here at NDARC, amongst other places. Now, the topic to be addressed today is vaping nicotine safer than smoking is one of the highest public health significance, given the enormous burden of disease that we know is contributed by tobacco smoking. The rise of vape products in the last decade, I think can be fairly described as one of those major sea changes that are periodically seen in drug markets, and one that I think has major implications for both public health and possibly for the treatment of nicotine dependence. We'll be joined in Q&A by two internationally renowned experts in nicotine dependence, Professor Hayden McRobbie, who's joining us from New Zealand, who works both clinically and in research, and Dr. Ryan Courtney, who is a researcher and head of our tobacco research program here at NDARC. Now, as always, please refer to the author's works for complete details of the issues covered in this webinar. Now, you may ask your questions on the Q&A function. Please not on chat, on Q&A, and I'll present them to the panel at the end of the presentation. I may not be able to ask them all, but I've most certainly endeavoured to do so. So now, Colin, it's over to you.
Right. Thank you very much, Shane. And thank you very much for asking me to present on my favourite subject, which is vaping. And as you say, it's a terribly important issue for public health. So this webinar will focus just on the safety aspects of vaping. And it's entitled, "Is Vaping Nicotine Safer Than Smoking?" And I think the topic is really important, the way it's been framed, because vaping is a cessation method for adult smokers who can't quit with other methods. And these people would otherwise be smoking. So our comparator to any harms from vaping is always going to be smoking, because very few long-term or regular vapers are not smokers. In the latest National Drug Strategy Household Survey, less than 3% of never smokers were regular vapers of weekly or more. So what we need to do is compare vaping to what these people would otherwise be doing and see how it compares. It's not really helpful to ask, is vaping safe? Because nothing is safe. Everything has risk. And that question really is relatively meaningless, I think. It's not helpful. The comparison is always against smoking, which is the alternative. So just a quick slide on what is vaping. So here we've got an e-cigarette or vaporizer or vaping product, and each product consists of a battery, a heating coil, a chamber full of e-liquid, and air holes which allow entry of air. So when the vapor breathes in, the heating coil heats up, heats the liquid nicotine into a vapor, which is then inhaled into the lungs, where it's mostly absorbed in the lungs. And then the person breathes out a cloud of what looks like smoke. And so it carries all those sensations and appearances of smoking. But what vaping essentially is a nicotine delivery system. It's another way of delivering nicotine to the body in a clean form, without any combustion, without smoke, and without tobacco. And that's really important because the key difference between smoking and vaping is that almost all the harm from smoking comes from the burning of tobacco and from the 7,000 or more chemicals generated by that process. And most of those, as we'll see, are absent from vapour. What's interesting about vaping is the confusion about risk and the perception of the public that vaping is much more harmful than it actually is. So many people think it's as harmful as smoking or even more so. And this latest research from the UK, from the HINTS survey by the National Cancer Institute, found that only 2.6% of the population thought vaping was correctly much less harmful than smoking. 14% thought it was less harmful. About a third thought it was just as harmful, and some people think it's more harmful. And that is a serious misconception, which is persistent, and if anything, getting worse. This is in the US, but similar studies in the UK and in Australia have found the same misperceptions. It's no surprise where those misperceptions largely come from. There's been a lot of hostile media about vaping, driven by various interest groups which are opposed to it, which have framed vaping as a much more harmful activity than it actually is. So the media reports have been very misleading. That they typically focus on negative aspects of smoking. They're often emotional. They frame vaping as being more harmful and being a concern, and focus infrequently on the benefits of vaping. And that's why I think that's the main reason for those misperceptions. So let's talk about, first of all, nicotine. Nicotine is, a very misunderstood chemical, and a lot of the concerns about vaping are linked to the misperceptions about nicotine and its harm. And these misperceptions are quite widespread. Many people think nicotine, because they associate it with smoking and they've heard how nicotine is the addictive chemical, they think it's the harmful chemical. And this is true even for doctors. In the US recently, a large survey found that over 80% of doctors strongly agree that nicotine causes cardiovascular disease, COPD, and cancer, or contributes directly to those conditions. So that's the general perception of nicotine, and which is a large part of the misperception about vaping safety. But when the research is carefully examined by independent organisations, and I've listed some of them here, I think it's really important to understand that the conclusion is always that vaping is less harmful than smoking. So the Royal College of Physicians, Public Health England, we're talking about nicotine. So the Royal College of Physicians has concluded that nicotine in the doses used by smokers represents little, if any, hazard. The Royal Society for Public Health says nicotine is fairly harmless. Public Health England says nicotine use on its own represents a minimal risk of serious harm. The New Zealand Ministry of Health has said for people who smoke, nicotine itself is low harm. And the National Health Service in the UK says, yes, it's addictive, but it's relatively harmless. So that's a long way from the popular perception of nicotine and its risk. And I think it's really important that we get that message out. We've been fighting with this issue for years with NRT, and one of the problems with compliance with NRT is getting people to accept that nicotine is not the harmful ingredient in smoke. That belief undermines the uptake and the continuing use of NRT where it can be helpful. So basically, yes, nicotine is innocent of those charges. The research shows, and the opinions of experts are, that it does not cause cancer. It does not cause respiratory disease. It only has minor effects on cardiovascular health. It does have some hemodynamic changes. It puts the pulse up temporarily, puts up the blood pressure temporarily. It may exacerbate existing heart conditions. If you already have a heart problem, it can trigger irregular heartbeat. But they're relatively minor, and there's no evidence of it leading to significant heart problems. It can reduce wound healing by vasoconstriction, constricting the arteries that bring the blood to the wounds. And it can raise blood glucose levels and theoretically can increase levels to the point where people get diabetes. But generally those effects are relatively small. In terms of long-term risk, we have evidence from nicotine replacement therapy for up to 5 years, 7.5 year follow-up in this particular trial, which found no evidence of any relationship with cancer. But the best evidence for the safety of nicotine comes from snus. Now, snus is a low nitrosamine pasteurized tobacco product that comes in little tea bags. You put them in the mouth and they deliver high levels of nicotine, similar to smoking. They've been used for decades in Scandinavia, and the global burden of disease study, like many other studies, found that there's no increased risk of serious health problems from long-term use of snus. So that would then mean that would apply to the use of nicotine, which is in fairly high levels and released in high levels from snus. So that's kind of proof of concept that nicotine long-term is likely to be very safe. What about in pregnancy and adolescence? In both cases, there's no evidence of harm in humans. So all the evidence we have that the nicotine is harmful in these two situations are from rat and mouse studies. And these studies, of course, are notorious for not necessarily being able to be extrapolated to humans for lots of reasons. So often the findings in laboratory tests do not represent findings in humans. And I think the bottom line is that nicotine may not be completely safe for these groups, for the pregnant mother and the fetus in particular, but it's always safer than smoking. And that applies to every context of nicotine use. But I think the most important message from this research is that adolescent and pregnant rodents should not vape. And we're very clear about that, and we have good evidence of the risks. So I can be quite confident making that claim. What we also need to keep in mind is that there are actually lots of positive benefits of nicotine. I mean, it's been demonized, but in fact, smokers will tell you they get positive effects from nicotine. It activates the reward system. It gives a sense of pleasure and reward by releasing dopamine. Even non-smokers get improved cognition, improved concentration, alertness, and memory improvements from nicotine. It's certainly true in smokers and not just from treating nicotine withdrawal. It does have a calming effect. It leads to relaxation and it reduces depression. It has a significant effect on weight control, helps to keep weight down. It's especially beneficial in schizophrenia for a number of the problems of that condition. It's neuroprotective and it's been shown to have substantial benefits for people with Parkinson's disease, and it helps to prevent Parkinson's disease. And there's growing evidence that helps to prevent or it reduce the harm from Alzheimer's disease. It's beneficial in ulcerative colitis, reduces your risk and reduces the treatment and the severity of the condition. It certainly helps ADHD, and young people with ADHD, of course, are much more likely to smoke because of that benefit that they get from it. And it increases the pain threshold. So when we're talking about the risks of nicotine, we've also got to weigh it up against the potential benefits which apply for each person. So moving on to vaping in particular, again, the same organisations I mentioned before, which reviewed the evidence, have concluded that yes, vaping is not risk-free, but it is far less harmful than smoking. So the Royal College of Physicians and Public Health England in the UK both concluded that vaping is at least 95% less risky than smoking. The peak scientific organisation in the US, NASM, concluded vaping is likely to be far less harmful than smoking. The New Zealand Ministry of Health says it's not harmless, but it's much less harmful. Health Canada says less harmful. And the Committee on Toxicity in the UK reviewed all the evidence and they said the relative risk is expected to be substantially lower. So I think the evidence is pretty clear that the overall effect of vaping is less harmful than smoking. And that's what we're most concerned about, because we're substituting vaping for smoking in people, obviously, who smoke. And obviously the main reason for this is that there are far fewer toxins, and they are in much lower doses in vapor than what we see in smoke. So most of the toxins in smoke are completely absent from vapor. According to Public Health England, those that are present are at much lower levels, less than 5%, mostly less than 1% than they are in tobacco smoke. There are some chemicals that are not present in smoke that are generated in vapor, but again, Public Health England has said regarding those specific ingredients that are just from vaping, there's been no significant health risks identified. And this graphic on the right side of the screen shows, yes, there are over 7,000 chemicals in smoke. There have been a number of studies looking at how many chemicals in vapor, generally less than 100, and of course at much lower doses. So what are these chemicals? Well, all products contain PG and VG, propylene glycol, and vegetable glycerin. While they're not completely harmless, the evidence so far shows very low levels of concern about these products. They are broken down by heating in vaping, and they do create carbonyl compounds, formaldehyde, acetaldehyde, acrolein, which are toxic. But they're in very low levels with normal use, and they only contribute to a very small, they only are in very small levels compared to smoke in vapor with normal use. So again, very, very low levels of those chemicals. Food flavorings are the one ingredient that we need to watch carefully. Again, Public Health England says, yes, so far, no clear evidence of health risks, but there may well be potential unknown risks. So over time, we may find, of the thousands of chemicals being used, we may find that some do cause problems. And there are some listed there that we know are potential problem causing flavouring chemicals. And once we identify those, of course, we can eliminate them, and those chemicals are generally not used. So over time, if problems arise, we can certainly address that. Metal molecules are leached from the vaping device into the vapor, but they're at very low levels, and the evidence suggests there are no significant safety concerns from the small doses of metals. Public Health England did a review of the biomarkers. So these are the chemicals from smoke or vaping which are detected in the body, in saliva and blood and urine. And this slide summarizes 12 studies. And they found significant reductions in the chemicals in the body of former smokers who now vape. So in the case of NNAL, which is a marker for a powerful lung carcinogen, the level was dropped significantly. And what this striped line shows is the level in non-smokers. So yes, there is some still detected in the follow-up studies, but at a similar level to that of smokers. The same for this biomarker for polycyclic aromatic hydrocarbons, which are, again, powerful carcinogens from smoke. The levels after quitting vaping, quitting smoking are down to the level of the non-smoker. Similarly with 3-HPMA, which is a marker for acrolein, which is a respiratory irritant. Again, the levels drop to the non-smoker level, and certainly carbon monoxide levels are significantly dropped. So in most cases, the levels drop to the level of a non-smoker when people are vaping. So that's really a really important indicator of risk. The other very important thing that we see all the time clinically, and it's been verified in a number of studies, is clinical improvements in people's health when they quit smoking and start vaping. So they'll tell you their lung symptoms have improved, and the most common thing people say to me is, I can breathe better, my cough's gone, I can run upstairs, which I didn't used to be able to do, and they can breathe better. They just almost invariably report that. Tests have shown lung function improves when people switch to vaping. Asthma and COPD both improve, and patients invariably tell you this. I haven't yet met an asthma patient who switched to vaping who hasn't had significant improvements in their condition and hasn't reduced their medication. and they get fewer respiratory infections. In terms of cardiovascular health, there was a very good study a couple of years ago found significant improvement in heart attack risk after a month, after only a month. A couple of studies have shown that in people with hypertension, blood pressure declines significantly when they switch to vaping. And of course, we need more research, but the evidence so far is all very, very supportive of vaping being a much safer alternative. Just looking at cancer, for example, the estimated lifetime risk of cancer from vaping is 0.4% of what it is from smoking. So less than 1 in 200 of what it is from smoking. Another study looked at the risk of lung cancer and found it was 50,000 times less than from smoking. And the reason is, these are all the main chemicals that cause lung cancer: NNK, polycyclic aromatic hydrocarbons, and so on. And in vaping, the levels of these products are extremely low or absent or in trace levels. So it's no surprise that the risk of lung cancer and other cancers has reduced dramatically. The other question is, what's the effect of vaping on bystanders? Secondhand smoke is a serious public health issue, but to date, according to Public Health England, the College of Physicians, there's been no identified health risks of passive vaping. And that's because when you vape, over 90% of the vapor is retained by the person who's vaping. There's no side stream vapor like you get with smoking, with smoke from the burning tip, and that accounts for about 80% of secondhand smoke. So that's entirely absent. Vapor is a liquid aerosol which disperses very quickly in seconds as opposed to minutes. It's a liquid which dissipates as opposed to a solid smoky aerosol. And one study estimated that the cancer risk from secondhand vapor is 50,000 times less than from smoking. So it's not, we encourage vapors not to vape around other people, keep that to a minimum. But so far, we've not identified any problems. And that's not to say there won't be problems in the future, but so far the evidence looks very promising. Just a quick word about popcorn lung. It's probably the most common question I get asked by people about vaping. It's just a condition that's caught people's attention and has fascinated them. But this is a condition caused, a serious lung condition in people who work in a popcorn factory and were exposed to high levels of diacetyl. And that's a flavouring agent that has been used in the past in some flavouring chemicals, flavouring compounds. But the dose in vapour is hundreds of times less than it is in smoke. And there have been no cases, not one case of bronchiolitis obliterans or popcorn lung caused by vaping or by smoking. So I think that's really something we don't need to be concerned about. And the other condition that's constantly raised and which has led to many people's fears about vaping is EVALI, which was a condition of serious lung disease in young people in North America in 2019 who had vaped. But what we found out subsequently is that condition was caused by the illegal addition of a toxic chemical to THC oils, which were being vaped. So almost all the people admitted using those contaminated oils. Some didn't, but it's very likely that they did and weren't willing to admit it for various reasons. But there hasn't been a single case of EVALI shown to be linked to commercial nicotine liquids. Long-term risks is another concern. We don't yet know exactly how harmful these products will be in the long term, like any new product. That's the case with every new drug or chemical or treatment that we introduce. We don't know until 30 or 40 years down the track. But we do know a lot about what's in vapor. We know that there are far fewer chemicals at much lower doses. And the Royal College of Physicians concluded that the hazard to health arising from long-term vapor from the currently available e-cigarettes is unlikely to be more than 5% of the harm. Problems may arise in the future, but based on what we know now, it's likely that the long-term harm will be much less than it is from vaping. There's very little research in pregnancy, but again, the principle applies here that the evidence of what's in vapor suggests that it's likely to be much less harmful than smoking to a pregnant woman. So if she's going to smoke anyway, switching to vaping is likely to be less harmful based on what we know so far. But we need some long-term studies to confirm that. Fires and explosions are another issue that is raised by people concerned about vaping, and this is due to malfunction of lithium-ion batteries. But people can get nasty burns and traumatic injuries from malfunction of those batteries, but they are very rare. Of course, they always hit the headlines, and they're mostly due to loose batteries. So some devices have removable batteries that are at risk of short circuits when they're put into a pocket, particularly with keys and other metal objects. And you can have problems of that type, but most cases are preventable. There have been 2 deaths from fires and explosions from batteries, but you know, that's over the last 15 years, and there have been, of course, hundreds of millions of deaths from smoking in that time. So it's really relatively minor. So over the last 15 years, yes, there have been 100 million deaths from smoking, not a single death from inhaling nicotine vapor. Yes, a couple of deaths from exploding batteries, a small number of deaths from deliberate and accidental ingestion of nicotine, but 0 deaths from inhaling nicotine vapor. So we really need to keep that perspective. So over the long term, how safe is vaping likely to be? Well, we don't know for sure, but the College of Physicians, based on the evidence review they've done, says that it's not possible to be absolutely sure, but the data that we have so far suggests they're unlikely to be more than 5% of the harms of smoking, and it may well be substantially lower. Now, some people have criticised this figure, but it's not meant to be an accurate figure of which we can say is an absolute number, but rather a ballpark. It's just a guide to people, so we know it's roughly in that range, and this is a guide so people can make an informed choice. It sort of gives them an idea of the comparison. So if you're a smoker, you'll certainly have substantial improvements. Just saying it's less harmful is not that helpful because that could be 30%, 60%, 99%. So we need something some sort of anchor for those perceptions of risk. And I think 95% is reasonable based on what we've talked about earlier. I think that's a reasonable assessment. Now, just a quick advertisement. If you'd like to know more about vaping, I've written a book which is for vapers, smokers, health professionals, which gives the evidence on vaping, its effectiveness, safety, the regulations, and so on. It talks about how to get started and how to make the switch. So how do you actually transition from smoking to vaping? What are the steps you need to take? And it talks about some of the controversies that are always being raised. There are 420 references, so it's certainly evidence-based, and it's available as a paperback and an ebook, and there's a link there to where you can find more information. So the take-home messages are that nicotine's addictive, but it's relatively benign. It's less addictive in vaping, of course, for a variety of reasons, but it's relatively benign. And it does have beneficial effects, which patients need to consider when they're weighing up doing that risk-benefit analysis. It has far fewer toxins than smoke and at much lower doses. Flavourings are a potential risk, and we do need more time to assess that risk as the years go by, but so far there's very little evidence of any serious concern. There are substantially reduced levels of chemicals in the body of vapers who have switched from smoking, so that's an important indicator of reduced risk. People who quit smoking and switch to vaping invariably report improved health, and that's confirmed by the research so far. We don't know the long-term effects, but it appears to be likely that the long-term risks will be no more than 5% of those of smoking. So I'll stop my presentation there and hand it back to the panel.
Right. Thank you very much, Colin. That's an incredibly interesting presentation, and it was raised a lot of, we got some great questions. But before I move on to them, what I might do is Hayden and Ryan, I'll start with you, Hayden. Just any brief comments you've got regarding Colin's presentation, things that stood out to you, and particularly as a clinician yourself.
Thanks, Shane. Colin, great presentation. And I think you provide a really nice overview of the safety, if you like, of vaping in comparison to smoking. So that proportionate risk. I'm just going to raise a topic that may be on a few people's minds, that's all very well, but what about the risks associated with vaping long-term among people who don't smoke? And taking that population health point of view, where you have to balance the benefits for smokers against the potential risks for non-smokers, and especially, and you know where the concern is and where I'm going with this comment, but that concern that young people who have never smoked, that start vaping, that become dependent on vaping and go on to use these things long term. And I suppose this is around looking at proportionate regulation. How do you make it available as a tool, a harm reduction tool among people who smoke, but do our best to keep it out of the hands of people that don't? And I guess I'll finish there by asking, has Australia got it right with its current regulations compared to New Zealand, the UK, the US, and others? Thanks.
I'll just get a quick response, Colin, then I'll get on to you, Ryan.
Yeah, look, I think Australia has definitely not got it right. I think we need to find that balance between making high quality products available for smokers to help them to quit when they can't with other methods. But there are ways to minimise access for young people. And I think we can do that. They're doing it in the UK. They've had very good results there. And just to answer your comment, yeah, look, of course, there are potential risks for people who have never smoked. That's obviously not something we recommend. But the uptake by adults who have never smoked is extremely low. So in all the international studies I've seen, it's less than 0.5% of the adult non-smoking population. And in young people, most use is experimental and short-term, and the evidence is increasingly showing that vaping is diverting young people from smoking. So smoking rates are falling faster than ever in countries like the US and the UK, where vaping is widely available. So yes, I think, but yes, of course there is a risk, and yes, we need to balance that and against the enormous potential benefits for smokers.
Right, thank you, Colin. Ryan, do you have any thoughts as a prominent researcher in the field?
Yeah, thanks, Shane, and Colin, great presentation. And following on from Hayden's comment, I guess it's quite peculiar, the Australian smoking cessation guidelines compared to some of the guidance around the world at the moment. It's sort of advocating for use if other treatments have failed. Then we've also got a system where a prescription is required, which at the moment can be tricky for a busy clinician to sort of work through how to write that script and what the process is. So what advice, or from your clinical perspective, have you found with GPs sort of understanding of current policies and practice and being confident and able to tell potential smokers that may want to use the products how to do so? And I guess further from that comment of Hayden's around our current perspective on availability, the flavour thing I think is important. Some countries have banned outright flavours, some have a few available. Where do you think we find the right balance with flavours, as we know that's so important for people to actually adhere and use and quite enjoy it? Whereas if you have flavourless, probably no one will adhere and use the product. So yeah, a couple of thoughts, and interested to hear what you think.
Yeah, no, they're very good points. I think The problem for GPs is that they've been subject to considerable negative messaging over some time about vaping. I mean, if the NH and MRC and the TGA and the health department are all saying, oh, we're not sure about this vaping, well, GPs are reluctant to go against that. And I think they're getting no training at all. So they don't know how to prescribe. They are getting messages that it's not good for you, and very few GPs are willing or able to help. And I think that's really a big problem, because we're making it harder for patients to access the much safer alternative. They can buy cigarettes anywhere. We're putting up all these barriers to accessing the much safer alternative, and I think that's a big mistake. As far as flavours go, I mean, you're right, flavours are an integral part of vaping, and they've been shown to increase uptake, increase effectiveness, reduce relapse, and I think we have to live with them. There's no point in having a treatment that works if no one's going to use it. And the reason why vaping is such a breakthrough is that it's the most popular quitting aid in Western countries and in Australia. And if you take out the flavours, you're going to do a lot more harm than good, I think. I think we need to monitor the flavours, monitor any long-term effects, eliminate flavours that we're concerned about. But I think the concerns about flavours are overplayed, in my opinion.
Right, thank you, gentlemen. That's actually covered covered some of the issues that our audience has raised. Anonymous attendee was talking about fruity flavourings to protect the children, and making the point that you can go into that flavoured drinks for alcohol are common. And also at the very beginning, we had Andrew Thompson asking about vaping as a diversion for young people from smoking, but I think we've covered that issue. What I would like to, however, there's an issue here, which I think is interesting. On the Colin, you talked about potential positive effects of nicotine, and there was talking about, say, ADHD. So one of the attendees is asking, is there an optimal dose for these positive effects on cognitive functioning?
I'm not aware of that. I know it's been trialled in Parkinson's disease, and I think people would titrate. I think if someone with ADHD wanted the effects of nicotine, I'd probably recommend lozenges, and then they'd titrate the dose to get the effect that they're looking for. So there have been a number of studies for some of these conditions, but I'm not aware of a measurement.
My understanding was there is an association with reduced risk or slightly reduced with Parkinson's, but I'm not sure if that's an artifact of other factors or not.
My understanding is that there's a fair level of confidence that does reduce the risk. It does reduce smoking. We know smoking reduces the risk of Parkinson's. Yeah. The evidence suggests that nicotine is the key ingredient there.
Okay.
And it does alleviate symptoms of Parkinson's as well.
Okay. Hayden, do you have any observations upon those sort of nicotine and cognitive? I hesitate to use the word benefits, but maybe amelioration of negative effects. Or
not to add much more to what Colin's rightly pointed out. I think I know in my clinical practice have seen anecdotal reports of some young people using vaping that reportedly help their symptoms of ADHD. But again, I don't think the evidence is strong enough to suggest that would be a good treatment for these conditions.
I suspect one of the problems we've got with all of this is we'll know the longitudinal studies are going to have to wait 20 years to see where we stand. I've got a question here, which is, and I'll actually throw it to you first, Ryan, because I know you've done trials on the nicotine withdrawal. For those vaping a considerable amount, is nicotine withdrawal an issue? Ryan, have you ever come across that in your trials?
Well, in terms of the empirical research, and I know that Hayden for many years has done this in the UK as well, so he can provide further comment, but we do know that vaping now is very good and efficient at nicotine withdrawal, reducing that and cravings. And so far, when you look at the pharmacokinetics of it, that it actually can reduce cravings just as good as any of the available pharmacotherapies at the moment. So I think that's one of the key factors, the ability for vaping now to be able to deliver nicotine at an optimal level for someone that does need that relief, which is one of the benefits. And then you've also got the sensory motor aspects of use, as well as the enjoyment that happens. But I might pass on to Colin and Hayden to provide further comments on reducing craving.
Colin, do you have any views on?
Yeah, look, it's effective. About a third of my patients stop smoking immediately. Others take a little longer for those where it works. But the other important issue is that it's easier to stop vaping than it is to stop smoking. And there have been quite a few trials now which have shown that when people find it easier to transition off vaping, and it's often seen as a sort of a halfway step towards quitting.
Yeah. Joe DeFlew has got a question here, my old colleague, Joe. What is the effect of effectively banning nicotine vaping in the Australian market? I suppose there's a few questions here. The development of a black market, and this goes back to, I think, Hayden's comments on the disparities between very similar societies with very different policies. So, Colin, what would you say about the way the market's been developing in Australia?
Yeah, look, I don't think there's any question that we've learned that prohibition doesn't work. Just telling people they can't have a drug, if they want it, they will find ways of getting it. There's nothing new about that. We saw that in the US with alcohol and all the other illicit drugs. People will find a way with the black market. They'll make their own. They'll import their own. It introduces all the crime and the judicial aspects of an illegal product. It's, you know, and the question is, do we have a right to ban something that's really doing no harm to people and in fact is helping them? I think it's unethical to say, well, you're a smoker, you can't quit. This could help you, but we're not going to let you have it because we have our concerns about it. So I think there's major ethical issues there, and I think the bans do more harm than good. And we've seen that in some studies overseas where they've banned flavors and banned vaping products. Smoking rates have gone up, and people have found ways around.
Okay, as people always do with every drug. We've got a question here from Tom. I'll start to you first, Tom, then I might get Hayden's views on this. Colin, by the way, we have viewers here today from the Philippines and Afghanistan, I should let you know, which is fantastic, and you're very, very welcome. Question here is, are there any harm reduction strategies that current vapers can do to further reduce their risk? We're talking about reduced risk. And they've got ideas like not chain vaping, using only certain products, cutting down. So I suppose with you, in your clinical practice, this would be an issue you'll be dealing with.
Yeah, look, I think there's a couple of things that can be done there. I think the amount of vapor that you inhale is a measure of the potential risk. So you're better off using a high concentration of nicotine rather than a low concentration, and therefore using smaller volumes of vapor. We know that the high-powered devices have more thermal breakdown of chemicals. So you want to keep the wattage of your device as low as is effective for you. And obviously to avoid, you have to select carefully where you buy your products, make sure they're regulated products. Products from New Zealand and the UK, we know that they're regulated. The illicit vaping disposable products, for example, that come from China that are being sold openly in tobacconists and in convenience stores clearly have no regulation. We don't know what's in them, and we certainly don't recommend those. So buy from a regulated, approved provider, and those other measures I mentioned.
Okay. Hayden, you're in a different legislative framework, so what's the situation with you here?
I absolutely agree with what Colin said. people get concerned about devices that have very high levels of nicotine in them. So some of the pod-like devices contain, over 50 milligrams per mil, but operate at low power and don't produce a whole lot of vapor, but are very good at delivering nicotine. And sometimes a worry that recommending these very high nicotine levels to people could be worse than using some of the lower nicotine concentration, higher wattage devices. And it's something that strikes me as, I get it, but I think this is where we have a role in being able to carefully explain this, because people, especially if you've got a smoker who's used to a certain blood nicotine level from their cigarette smoke, switching to a device that's not going to give you enough nicotine is only going to mean that you are vaping left, right, and center every day, all day, and that could potentially increase your risk. So it's not, I think when we're looking at devices and nicotine concentrations, it's not a one-size-fits-all thing. And sometimes your higher level nicotine delivery system that operates at a lower temperature without all of the vapor actually may be the less harmful product. So I think we just need some care wrapped around that. The other thing that I would usually say to my patients is, as soon as you feel safe not to go back to smoking, aim to stop vaping as well. Now, how long that period is very individual. And that's why I think it's important that the person feels safe that they're not going to relapse. If they're going to relapse, they're better off to carry on vaping.
Yeah. We've got a question here from Joe Busamra, which I might throw to you, Ryan, in terms of what the literature says. Joe asks, why is it easy to quit vaping if nicotine is delivered better to the brain than by a cigarette? I mean, does the literature tell us anything about cessation for these two types?
Yeah, I think that's a really good question. I think that we're up to in terms of how easy it is to quit vaping versus smoking cessation, I think is still not necessarily answered, and we need to know more. I think the next best related to care factor, I think, as Hayden was saying, was, well, now we're at a point where we may have people that get to a point where they feel that it may be safe, or they may not feel that they have the confidence or ability to stop vaping. So I'd like to get the panel's views as well on this, is where do we lead them to? Do we lead them to use licensed products that we know that work for combustible tobacco, like varenicline and your nicotine replacement therapies? But we still, from clinical trial evidence, is my understanding, we don't necessarily have data to suggest that they will work for vaping for those that solely vape. So it is very much an unanswered question, I would say, and work needs to go into it. But interested in Colin, Hayden's and Shane's perspective on the roadmap.
Yeah, Colin, what?
Yeah, I think just to answer the question, I think we now know that there are other chemicals in tobacco smoke that increase addiction. So we know that there are monoamine oxidase inhibitors, and probably carbon monoxide enhance the addictiveness of nicotine. So they're probably the main reasons why, and perhaps other unknown factors why cigarettes are more addictive, nicotine. So we know that nicotine addiction depends on the delivery system. And the cigarette is a very dirty delivery system with lots of other chemicals, and it is more addictive, I think, because of that.
Right. So you're not comparing like with like, so to speak.
No,
right.
There's more going on. Yep.
I've got a couple of questions regarding respiratory health here. One's from Hayley Bowen, who's just, and Hayley's saying this is anecdotal, but she's got anecdotal reports from clients of feeling heaviness in the chest and reduced lung capacity when exercising with vaping regularly compared to smoking. Is this real or is it anecdotal? I'll throw to you, Colin, first, and then I'll get.
Well, it's not what the empirical evidence is saying. So the studies are showing that people are breathing better, their lung function improves, and certainly the anecdotal evidence I have from smokers is, as I said, they almost invariably say their breathing is so much better. So I'm not sure why those reports are coming through. I guess everyone's different.
No, but it's good to be able to point to the literature. Hayden, did you have any views on this? Or has this ever come up in your clinical practice?
Look, people report all sorts of things from vaping, and vaping is quite different to smoking. A lot of people find it a little bit more harsh than smoking. Well, even though at the very beginning of their smoking careers, they may have found smoking a bit harsh as well. But the bottom line is nothing is as bad as smoking cigarettes.
Okay. I think that's fairly straightforward comment. Colin, I got a question from someone from the Matilda Centre here in Sydney. It's seen case reports of lipoid pneumonia associated with vaping. Have you ever come across any cases of this associated with vaping?
No, we'll never have, but there have been a number of cases attributed to vaping. But what the experts tell us is that these are not due to vaping. In fact, there are no lipids in vaping. So propylene glycol and vegetable glycerin, which the main carriers are not lipids, which although they're sometimes said to be, they're actually alcohols. And there's no way you would get lipoid pneumonia from vaping commercial nicotine products. If you're mixing your own products and using lipids, like they did with the that was a lipid-containing product in the US when they had that outbreak of EVALI. They had lipid in those vaping cartridges, but just with commercial nicotine vapes, no, there's no lipids, so no lipoid pneumonia.
Okay. The question here, I might throw this to you, Hayden, first, from David Grace here. So are there any studies of vaping in patients with chronic kidney disease? Is it safe? It's got smoking is a major barrier to listing on the kidney transplant wait list, and they're wondering what the situation is with nicotine vaping and kidney disease.
Well, I'm not aware of any specific evidence in this particular group. And this comes up, people often ask me these questions with nicotine replacement therapy as well. Yes. But again, if you take the lessons from this particular presentation and looking at proportionate risk reduction in this case, if they're smoking and they've tried to quit and they tried other things and they're not working, then again, vaping is going to be a less risk than if they carried on smoking. You might, in terms of evidence regarding wound healing, you might advise not vaping in the immediate perioperative period.
Yes.
Most people who've had a kidney transplant probably aren't really up to doing much in that time anyway.
Would you concur with that, Colin? Or?
Yes. Yeah, I'm not aware of any empirical evidence, and certainly vaping's got to be safer. And I think if someone was offered a renal transplant and they were vaping, I think it would be a bit rough to withhold it for that reason.
Yes, I would think so. We've got an excellent array of questions, by the way, today, and it's been such a good panel. But Rhea Hopkins, who's one of our postgraduates at NDARC, has asked the question, Colin, is there any evidence about differing safety profiles between regular nicotine e-liquids and nicotine salts? I must admit, I'm not familiar with the distinction.
Yeah, so there's two kinds of nicotine used for vaping. So free-base nicotine is used for lower concentrations of nicotine, so concentrations generally 3 to 18 to 24. But after that concentration, it's rather harsh on the throat. So if you want to use a high level of nicotine concentration, you go to a nicotine salt, which is basically free-base nicotine with an acid like benzoic acid or lactic acid added to it. And nicotine salt is smoother on the throat, gives you less throat hit, which is a problem with high doses of freebase. And it's also absorbed more quickly. But they're equally potent, and I'm not aware of any safety issues. They're both equal in the way they affect the body.
Okay. Ryan, has this the addition between liquids and salts come up in your trials of vaping for cessation?
No, not necessarily. No, definitely not. Participants don't necessarily ask the question at that level. But I think the key distinction in terms of e-liquids and devices now is the fact that we've got 4th generation devices with disposable cartridges that can easily clip in and be used. I think the way that the products have developed with use of easy ability to use, I think, has been a bit of a change related to the first, when we had tank devices with, having to fill them up and make sure the coils fitted properly and putting it together. It was always been problematic. So I think the advances there towards 4th generation has definitely made it easier for vapors to use products. I think Colin and Hayden look like they're nodding. I hope that's yeah. Okay. Yeah, that's a good sign.
Yeah. We'll take that as concurrence, or they're being very polite to you, Ryan. That's we'll take it as concurrence. This it's now I've got a question here from Khaled Kamalnaz, and I'm not certain, and perhaps Colin, you could, if you notice an increase in GPs willingness to prescribe nicotine with current unavailability of Champix in Australia.
Look, it's hard to know. I think GPs are generally reluctant. I see a lot of patients for nicotine prescriptions, and they almost always say, look, I went to my GP and the GP said, yeah, that might be all right, but I don't have any idea how to write a script. Yeah, I've got nothing to compare that with, but whether there's been a change in vaping because of lack of Champix, again, I don't know.
Yeah.
Champix hasn't been available for quite some time, and it would bring vaping up the ladder. It's a second-line treatment, but currently all we've got is NRT and bupropion, and Champix is unlikely to be available still for a few months.
Yeah. Hayden, just with the New Zealand situation, what's the role of GPs or doctors generally in the sorts of issues that Colin's talking about in Australia, you have to prescribe, etc. I mean, what's the role of a GP in the New Zealand situation, which has a more liberal approach?
Well, the role of the GP and other, in fact, all health professionals in New Zealand has always been, advising people to quit and offering support to do so. In New Zealand, we have readily available stop smoking services in every area, who most now are utilizing electronic cigarettes, vaping products within their practice as well. With some are giving them out, others are giving vouchers to be used at a local vape shop. I think in general, GPs in New Zealand would be happy to discuss vaping, but they don't have to do anything else than say, okay, pop along and see the people that are better at this than I am.
Right. So there's less onus being put on than the Australian situation, where from a lot of the question, it puts a lot of focus and pressure on GPs, Colin, wouldn't you agree?
Exactly. And the GPs are not getting any training, Shane. That is a serious barrier, that they just don't know how to write a prescription. They just don't understand vaping. They have no idea about the devices. And it's not their fault, but they're not getting trained. And I think that, and when they're the gatekeepers, it's wrong, I think, that people are being denied vaping because of that lack of expertise and experience.
Yeah, it's across the board. With every problem, the first response is GPs should screen for it. So, you go in with a head cold and for an 8-minute consultation, and you're screened for every disease under the cosmos, psychological and sociological. It's unfair to expect GPs to shoulder this blame and be across every aspect of health and addiction.
Look, I think smoking cessation is a core business of general practice, and I think it's appropriate that GPs could give advice on that.
Yeah,
I think the real experts are the people in the vape shops. I mean, they're former smokers who now vape and who have made it their business to help people quit smoking, and they're up to speed with the devices and the liquids and the maintenance and all of the technical aspects. But doctors can certainly give their support and give information, but I think we need to work with the vape shops.
But they need to have that information.
They need to have that information, exactly. And I think it's actually a big mistake that they have not been trained adequately.
Yeah. All right. Well, look, we've come up to 4, and look, that has just been such an excellent session. Thank you, Colin. It was just fantastic. The quality of the questions shows the interest and the breadth of knowledge of our audience. Hayden, thank you, sir, for making the time from your busy day in New Zealand, despite the fact he's pretending to be in Randwick, he's in fact not. Ryan, thank you, sir, for, as always, for your observations. It's been a really great panel, and I thank you all. And I'd like to thank you, the audience, who've come in great numbers. It's been a real pleasure to host this today, and I wish you all an excellent afternoon/evening. Bye to all. Thank you.